Chips 3 Charts and Instruments in Pathology for Students. I'm sure you people will be able to identify these. These have been haunting us from the first year onwards. Yes, the improved neubauer chamber. And how will you know that it is the improved neubauer chamber? We shall be seeing. And this can be asked as a Viva OC, as I had mentioned, a spotter, and in a few other subjects as well. Whenever an instrument is given to you people, we are supposed to identify, then mention the parts, its applications or uses. What are the advantages, disadvantages? What can be the causes of error? And in such a case, what is a replacement or a substitute? I would like you people to kindly follow this for any of the instrument. As I told you earlier, what is the instrument? The answer is given over here. It is an improved neubauer chamber, which students don't answer. They don't look at the instrument at all. It is given over here. It has got a depth of about 0.1 millimeters. And there is a H-shaped trough. You find trough means there is a depression. So this is H-shaped. And there are two platforms. So I can do the counting either here or here. And also there are some raised ridges by the side. I'll show you that in a line diagram. Please remember the H-shaped trough, the two platforms for counting, and the ridges. And it is an improved neubauer chamber. What are the uses of it? Obviously, an RBC count, WBC count, sperm count, and a platelet count. All these cells have got a high number, therefore, we need a chamber such as a neubauer chamber. Whereas for a CSF, etc., the cells are few, we will be using another chamber called the Fuchs Rosenthal chamber. This is an important diagram I would like you people to kindly follow. I find that there is a thick cover slip, specially used for the neubauer chamber. And this is the trough or the depression on either side. And this is the platform. And these are the ridges which will be supporting the cover slip. So the trough you people can make out the counting chambers, ridges, and the thick cover slip. A spelling is over here. And the depth of the chamber is about 1 millimeter. And whenever I do fill, I find that it will go in by capillary action. The diluted fluid along with blood will go in by capillary action and no pressure is required. So this is called charging the chamber. The error in this can be overflooding. Sometimes it is not supposed to go into the troughs on either side. Underfilling, there will be a large air bubble. And another error is we start the counting immediately. Usually we should allow all the cells to settle down to a particular plane and then do the counting. These are the common errors in counting in a neubauer chamber. The squares, just for a recapitulation, it is the counting chamber is 3 into 3 millimeters. The RBC has got one large square, 1 square millimeter, and I will be doing the counting in the 4 corner and 1 central small square. WBC similarly has got 4 squares. Each one is about 1 square millimeter in dimension. The advantages of an improved neubauer chamber is there is a triple ruling. Because of that, we are unlikely to miss it. It is mercury coated. Again, the linings can be identified. There are 2 chambers. So I can charge both the chambers and do the counting. The disadvantages are manual error. At every level, there will be a manual error. There can be a counting error. And last but not the least, it is an outdated procedure, but still kept for our examinations. So we shall remember so long as the exams are there. And regarding the replacement, nowadays we have got even automatic cell counters. Most of you will be aware of it, and it is being used in all the major hospitals and laboratories. I will not be going into the details of it. Automatic cell counter or a seismic cell counter, you people should mention. See you in CHIPS 4.